Great, thanks very much. Thank you, Premier. Thank you, Minister. Special thank you to Dr. Hinshaw, who has done incredible work throughout our pandemic response. This afternoon, I want to respond to suggestions that AHS failed to prioritize contact tracing as a key tool in our fight against COVID-19, and nothing could be further from the truth. From the very beginning of the pandemic, AHS identified contact tracing as a vital way to track community spread, to limit transmission of the virus, and to protect Albertans. Along with testing, the use of appropriate PPE, and now immunizations, contact tracing has been one of the cornerstones in our pandemic response. But it has always been one cornerstone. Contact tracing by itself does not bring down case numbers. It allows us to track the virus, to ensure people who may have been a contact are isolated, and limits community spread. We've seen that occur throughout the pandemic, most recently at the peak of the third wave. Contact tracing coupled with public health restrictions, masking, physical distancing, isolating when sick, and even simple hand washing are the most effective ways of protecting Albertans. Those tools have now been bolstered further with the vaccine. Innovations include text messaging, auto-dialing, and timely resources on our website so that Albertans could access information about contact tracing quickly and easily. Staffing our contact tracing teams has always been a high priority to ensure that we have the people in place to trace as many cases as possible. Our contact tracing system has never collapsed. Far from it. And such a suggestion does a disservice to our hardworking and dedicated teams who have done incredible work during all three waves. Since the beginning of the pandemic, AHS has aggressively recruited case investigators and contact tracers, as well as implementing innovative tools and solutions to increase our case investigation and contact tracing capacity. Our original team of 50 contact tracers in March of 2020 grew approximately to 300 in July, 700 in September, and 1,250 by the end of December 2020. From September the 25th to January the 25th, more than 1,250 formal offers to new contact tracers were accepted. About 1,000 new staff completed orientation in January of 2021. As an example of how we ramped up our contact tracing teams, at the peak of the first wave last spring, we had a high of 95 contact tracers working on any given day. At the peak of the second wave, we had 551. And at the peak of the third wave, we had 1,902. Our aggressive recruitment strategy also included agreements with Shoppers Drug Mart and the Ian Martin Group to provide regulated healthcare providers to support case investigation and contact tracing efforts, recruitment of Statistics Canada employees, international medical graduates, furloughed WestJet employees and AHS volunteers, work with professional colleges and associations across the province to share case investigation and contact tracing job opportunities with their membership, including retired and inactive members. It is true that we did experience some challenges last November and December when case numbers spiked. However, AHS continued to complete case investigation and contact tracing throughout the second wave. During November and December, our teams continued to call and complete case investigations on all high-priority cases. We communicated with all Albertans transparently at that time to let them know what was happening, and we built in automation for connecting with close contacts. As case numbers rose, we recruited and onboarded staff as quickly as possible. We were supported throughout this phase by Alberta Health. Coupled with stricter public health restrictions, which helped us reduce community spread, contact tracing was able to catch up with the number of daily cases, and we were again able to trace every case. During the Wave 3 peak, our tracers investigated more than 2,400 cases in one day, and on multiple days investigated more than 2,000 cases. And they were able to reach people who had tested positive within 2 to 5 hours, 80% of the time. This is an amazing achievement, and we should celebrate their work. Many jurisdictions have come to see what we're doing in Alberta and have learned from our innovations. Our teams continue to contact and investigate all COVID-19 cases within 24 hours of receiving confirmation of their positive test result. This has been happening since January the 9th. Now that case numbers are decreasing, we're again looking to adjust our contact tracing teams. We will continue to monitor carefully the daily COVID-19 numbers in all areas of the province and adjust our contact tracing and investigation capacity accordingly. If numbers surge, we increase capacity. If numbers drop, we will shift staff to other areas that need more support. Be assured that we will maintain a robust team that will remain responsive to the evolving needs of the pandemic. We are well positioned to be able to meet the future demands for contact tracing in the province. Thank you.